Hello friends, I'm Dr. Komal Bohra. I'm consultant neurologist. So today we'll be talking about Parkinson's disease. So Parkinson's disease is a most common movement disorder. So the problem with the Parkinson's disease is there is lot of unawareness and many people do not know that they have Parkinson's disease. So today we'll be talking about the symptoms of Parkinson's disease, how do we identify Parkinson's disease, how do we treat it, diagnose it, and then what are the treatment modalities. So diagnosing a Parkinson's disease, so there are a core amount of symptoms which are differentiated into motor symptoms and non-motor symptoms. So motor symptoms include wrist tremors, bradykinesia, rigidity and postural instability. Wrist tremors in the sense there would be to and fro movements of the arms which may start in one arm and spread to other parts of the body, and because of the rigidity the patient feels stiffness and difficulty movement. And bradykinesia means that there is slowness in all the activities and the time which the patient takes to do the normal activities increases, causing slowness in the gait. And then there is postural instability, and sometimes because of this postural instability patients can have falls. So these are the most common motor symptoms, and the non-motor symptoms are constipation, different behavioral changes can occur, there could be memory disturbances, and each patient may present with different combination of the symptoms. And the diagnosis of this disease, it is not mere depending upon the investigations, but it is depending upon the clinical history and the examination by your neurologist. And once if there are any of the atypical findings, then only the investigations are required, and this investigations can be MRI brain, a PET scan, or if needed the advanced imagings like DAT scan. And apart from this, why do Parkinson's disease occurs? So there are some neurotransmitters called as dopamine which are produced in the brain, and this dopamine is required for coordinating the movements. So in Parkinson's disease the dopamine cells tend to die, and because of the dying of the cells the dopamine levels decreases and there is a change in the coordination of the movements. So the cause of this dopaminergic neurons death is still not known, but it is assumed to be due to the combination of genetic as well as environmental factors, and there is tremendous research which is going on to identify the cause of the symptoms. And then coming to the treatment options. In the treatment options, there are tablets, medications which increase the dopamine levels which have decreased in the brain. So there are quite different group of drugs which would increase the dopamine levels, and they will cause dramatic decrease in the symptoms. Apart from that, there is one of the surgical option which is known as DBS, that is deep brain stimulation. In deep brain stimulation, the one of the area where the dopamine neurons are present, the leads are put at that area to stimulate the neurons to release dopamine. So apart from this deep brain stimulation, nowadays there is another advanced option known as apomorphine, that could be in the form of pen or injections or a continuous infusion. This is usually these options are taken in an advanced Parkinson's stage where the medicines no longer works, or medicines cause troublesome dyskinesias, that is extra movements or totally off straight. So these are the conditions where we can try off apomorphine or DBS. Thank you. For more information you can contact us.